Johnson with Rose Med Spa and Wellness, and if you've recently booked a filler appointment, I want you to take just a minute so that I can explain what we'll be doing during your visit so you know exactly what to expect. I think a lot of people think filler is something that just goes in the lips or on a specific line, but at our practice, we really want to focus on something called full face balancing. What that means is that instead of just chasing individual wrinkles, we step back and look at the entire structure of the face. During your consultation, we evaluate things like your bone structure, how your fat pads are sitting, the quality and elasticity of your skin, and we create a plan that restores what has been naturally changed over time. There are really three main things that cause your face to look older. First is loss of bone density here, especially in the cheekbones and in the lower jowls or face. And so when those cheekbones lose support, the tissue above it drops slightly, and that contributes to the jowling or heaviness in the lower face. The second is loss of collagen and skin elasticity. Over time, our skin simply produces less collagen, and so the skin becomes thinner and less tight. The third thing is the loss or shifting of the facial fat pads. So that makes you lose some of that youthfulness and fullness that maybe we had in younger years. So when we talk about restoring the face, we're really addressing structure, support, and quality. There are two main categories of injectables that we use to do that. The first is a hyaluronic acid filler, which you may have heard of. Hyaluronic acid is just a substance that already exists in the body. It's found in things like your joints, like between the vertebrae. It helps give cushion and retains moisture. So these fillers are great for adding shape, contour, and hydration to the skin. And they're commonly used in areas like the lips, the cheeks, the jawline, smile lines, under the eyes, etc. Most HA fillers last about 9 to 12 months, depending on the area where you're using the products. The other category is what we call biostimulators. A common example of that would be Radiesse. That's the name brand. Radiesse is made from calcium hydroxyapatite, which is just a mineral similar to what's found in your bone. So instead of just filling space, it actually acts as a scaffold under the skin, and it stimulates your body to produce new collagen or replace bone loss that aging has caused. Because of that, biostimulators are often used in areas where we want to restore structure or improve your overall skin quality. That would be more like the jaw, the cheeks, the temples, hands, neck, and body areas. With a product like Radiesse, you'll see some immediate improvement, but the real magic begins to happen over the next few weeks or months as your body builds new collagen. Because remember, we're just stimulating your own body to produce what it should produce. That's one of the reasons these treatments can last longer than a traditional filler, which means that this could last 12 to 18 months or even longer, depending on the area treated and how fast you metabolize things. During your appointment, we'll talk through which approach makes the most sense for you specifically. Some patients do best with hyaluronic acid fillers, like if you want your lips done, that's going to be an HA. Some benefit from a biostimulator, and some people may actually benefit from a combination of both. Our whole goal is not to make you look different or overfilled. Our goal is to restore balance and support so that you look like yourself, just a more refreshed version of you. So when you come in, we're going to go through photos, talk about your goals, and create a plan together. So I'm looking forward to meeting you, and I hope you feel confident about your treatment. If you think of any questions, please bring them to your appointment, and we'll be happy to discuss it with you.